Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, I've had several situations where the only medication that worked for a patient was pulled from the market because of a rare side effect. Rather than switching to something else, the patients sometimes want to stay on the medication until they exhaust their supply. If I get their informed consent, can I tell them it's okay to continue with this fall under the FDA's compassionate use exception? Let's start with the compassionate use question. The program that most people call compassionate use is technically known as the Individual Patient IND application. And it gives patients who are in desperate situations access to promising drugs that aren't yet on the market. But it has to be a promising drug that's not yet on the market, not an unsafe drug that's been pulled from the market. So the compassionate use program isn't going to help you. The other part of your question is whether it's acceptable to get the patient's informed consent and then have them continue the medication. And the answer is that it's not. We need to remember that drugs are pulled from the market because they're not safe for human consumption. They're not medically acceptable for any patient. They're not legally acceptable in any situation, and informed consent can't make them acceptable. Informed consent's useful in a number of different ways, but it can't turn an unsafe drug into a safe one. And that's true even if the patient is completely informed and eagerly consents. This is a difficult situation, and I understand why the patients want to continue the medication. But you absolutely have to recommend that they stop, offer an alternative, and then document that you've done so. Anything less than that is outside the standard of care, and that's somewhere that you never want to be. Thanks again for listening.